Welcome to the Increasing Language Access in Oregon Learning Module Series. This Learning Module Series presents content from a resource called Increasing Language Access in Oregon, a workbook for providers, which is a plain language, actionable workbook focused on meeting language needs in healthcare settings. There are a total of 7 modules in the series, all of which are intended to be alternative format materials to the different chapters and appendices of the workbook. All recorded modules are available on the OHA Transformation Center website. This module focuses on the content in Appendix 1 of the workbook, Workflow for Providing Language Services in Oregon. Appendix 1 walks through a practical workflow that supports the use of qualified and credentialed interpreters. It's designed to be flexible. Organizations can adapt the steps based on their staffing, structure, size, or existing language access processes. Each step highlights who does what, when to take action, and how to document interpreter use accurately. This visual flowchart provides a quick overview of the full process, from identifying a patient's language needs at intake to documenting interpreter use after the visit. As we move through the next slides, we'll break down each step in more detail so you can see how it applies in everyday healthcare settings. Step 1 begins at the very first point of contact. Establishing a patient's language needs early on ensures compliance with both Oregon law and federal civil rights requirements. Staff should ask every patient at scheduling or intake what language feels most comfortable when talking about their health. For example, staff might say, "Can you tell me what language feels most comfortable when talking about your health? We can offer a professional interpreter at no cost." Once identified, staff should document the language in the electronic health record, note any dialects, and record how the patient prefers to communicate, whether in person, by phone, or video. This first step is typically completed by front desk staff. However, it's important to note that the roles listed under Who Does This are examples. Every healthcare organization is structured differently, so responsibilities may vary based on staffing, workflow, and available resources. These suggestions are meant to help you think through who in your organization might take on each task and how these steps could fit into your existing processes. Sometimes a patient may decline interpreter services. When that happens, care teams still have a responsibility to ensure the patient understands key information about their care. Staff should explain that interpreters are credentialed professionals bound by confidentiality and accuracy standards. A helpful way to phrase this is, "Our professional interpreters keep your information private and make sure you understand everything correctly. Would you like me to connect you with one for this visit?" Step 2 focuses on keeping patient information up to date. This step is typically completed by front desk staff or clinical staff at check-in. Preferences can change over time, so it's important to confirm or update language and interpreter needs at each visit, especially for returning patients. Staff should review the electronic record for accuracy, check the preferred communication method, and note any changes in interpreter modality, such as in-person, video, or phone. Step 3 focuses on connecting patients with a proficient in-language provider or a credentialed interpreter listed in the central registry. This step is usually handled by front desk staff or a care coordinator. Staff should always start by searching the central registry to find an interpreter who meets Oregon Health Authority requirements. If the organization uses a language service company or other vendor, staff should confirm that they also check the central registry before assigning an interpreter. Some clinics may also rely on bilingual staff who are credentialed, or in-house interpreters who are already listed in the registry. The goal is to match patients with qualified professionals who can provide accurate, culturally responsive communication. If a credentialed interpreter is not available, front desk staff or care coordinators should record their attempts to schedule one and document the reasons for unavailability. This documentation shows that the organization made a good faith effort to meet the patient's language needs. Staff should note which central registry interpreters were contacted, the interpreters' names and languages, and the modality used, such as in-person, video, or phone. Clear documentation helps track gaps in interpreter availability and supports compliance with meaningful language access requirements. Step 4 helps keep everyone aligned and avoid last-minute scheduling surprises. This step is typically managed by front desk staff or the care coordinator. Before the visit, staff should coordinate the interpreter's availability, confirm credentials in the central registry, and include interpreter details in the appointment notes or the electronic health record. Once confirmed, staff should inform the care team that an interpreter will be present so they can plan accordingly. Staff should also notify the patient that an interpreter will be available during their appointment. In some cases, it may be helpful to arrange a short pre-visit huddle between the provider and interpreter to share clinical context, review key terminology, or discuss any cultural considerations. If the patient declines interpreter services after scheduling, staff should follow the same documentation processes described earlier. These steps are taken by front desk staff or care coordinators. Taking these steps ensures everyone is prepared and communication runs smoothly. Step 5 occurs when the patient arrives for their appointment. Front desk staff or care coordinators should reconfirm the patient's preferred language, check that the interpreter request matches the current need, and verify the interpreter's identity and modality. Staff should also review the existing documentation and update it if there are any changes to interpreter details or patient preferences. Doing this at check-in helps prevent mix-ups and ensures the right interpreter is ready before the visit begins. Step 6 encourages a brief pre-visit huddle between the provider and interpreter. This step is usually done by the provider, care coordinator, or interpreter. A short 2 to 3 minute conversation helps clarify goals, sensitivities, and communication cues before meeting the patient. For in-person visits, providers can plan seating arrangements so both patient and interpreter can see and hear each other clearly. For remote visits, staff should test video and audio connections before the patient enters the room. A simple phrase you can use is, "Today we'll be talking about X topic. Please interpret everything I say directly, and if something isn't clear, let's pause and check in together." Step 7 takes place during the patient visit and is led by the provider with the interpreter present. Providers should position the interpreter so they can both see the patient and provider clearly. Speak directly to the patient in the first person. For example, say, "How are you feeling today?" instead of ask them how they're feeling. Pause regularly to allow time for interpretation and the patient's response. Following these best practices maintains clarity, supports patient dignity, and ensures communication is accurate and respectful. Step 8 focuses on continuous improvement and quality assurance. Staff should capture feedback from both patients and providers about interpreter services, review modality preferences, and track data on when interpreters are scheduled. Reviewing this information monthly can help identify trends, training needs, and opportunities to strengthen language access policies. Keeping patient records updated also supports accurate reporting for meaningful language access compliance. Staff such as clinic leadership can take on Step 8. Thank you for reviewing Appendix 1, Workflow for Providing Language Services in Oregon. This workflow is meant to serve as a guide for providers and health systems to integrate language access into everyday practice. This concludes the Learning Module series. All learning modules are available on the OHA website.